for these reunions. Invariably, they will involve walking and many other activities we do together. I didn't want to take a risk in that getting impacted. So I said, all right, let's fix the date. And he said, you should also book yourself a room, which I did. Now, when I look back on it, no physical examination was done. No ECG or echocardiogram taken or any other test. Straight away, I need an angioplasty based on whether he saw the film or didn't see the film or he went by what he heard on the phone. Now, once I came away from the hospital, I began my due diligence for a second opinion. For this, I turned to my old friend, who many of you would know, Dr. Ranga Naik of Vikram, which has been acquired by Manipal. Ranga asked me to send the CD. I realized that none had been given to me. I called the doctor or manager who's in charge of navigating so-called important patients through the hospital. So they've got a well-organized section for that. He sent me an X-ray film. So I sent that on to Ranga. He responded that he could do nothing with this without the CD because that just showed a point view. So then again, I called up this worthy gentleman, and first he told me they don't have a CD. But later, the next day, he called me back and said, I do have a CD. And if you send your driver once more, I'll give the CD to him, which I did. And thereafter, I sent this on to Dr. Ranganai. When Ranga received this, he called me back again and said, Ashok, I'm really puzzled by this. I have shown the CD to 3 different radiologists who say there is no blockage in the left main, but some blockage in the minor vessels. I immediately canceled the surgery, and then I turned to my dear friend and medical advisor on all matters really, Dr. Paul Savines, who I just mentioned both at MSMF and Narayana Health, who will be with us later at the end of the day to give his talk. Paul suggested I meet Dr. Cherry in their hospital. This venerable doctor was then 90 years old and was still practicing. Sadly, he has passed away a few months ago. In stark contrast with what happened with Dr. X at Hospital YY, he did a thorough physical examination first. He then recommended a series of tests in good shape, and you don't need any intervention. Early this year, he did not worry any further, and you don't even need an angiogram just to get a direct look at my heart. If your heart is like that in the body, he actually had all my results into here today. You know, when the tests were done, he indicated hip process. Now, you know, frankly, I don't believe that. He had inserted some stents. How would I have ever known that those were necessary? And then my body would have been impaired one way or the other. He would have destroyed my self-confidence. I was just starting SCAN and Happiest Health. And I needed so much international travel in those early years of founding those 2 entities. I would have even hesitated to do all of that. I did refer the matter to the chairman of Hospital Y, and he immediately constituted a high-level inquiry committee, which also confirmed that Dr. X had not followed due process in my case, and he had been duly cautioned. And I can say a few words. Yeah. And I wish you a better chance to hear and see a very serious problem. It's we need aims instead of getting the students is very
of the program. The new announced the partnership for ethical healthcare in Karnataka. So, of course, healthcare is something which is a very important subject for the society. and the way we are able to take care of our people and to look after their needs in terms of health becomes a very important responsibility of the society and of the government. And when it comes to health, there is so much that is going on in today's world. We see there is so much expansion of healthcare facilities, various new protocols, treating people, and there is, and also the cost of treatments also have increased tremendously. So there is a huge variation in terms of being able to treat a particular person. It depends upon how much the person can afford. The more he can afford, the more higher end the treatment can go, and it can go into astronomical amounts also. And healthcare is something which both public sector and private sector both are there. And government responsibility to see that we give affordable healthcare and free healthcare for the poor people, so that the basic healthcare needs are met. And for the government, another very important part of healthcare becomes preventive health, which not many in the private sector will really get it, because when it comes to prevention of preventive healthcare, where we focus on detection, we focus on trying to control spread of diseases, whether it's communicable or non-communicable. This is something where the private sector doesn't really get it because there's not much revenue or profits to be made. And it is also the responsibility of the government to do it, because this is one of our important jobs. And so this is where we as a health minister are really trying to focus on, is that how we can prevent people from getting into bad situations. How we can improve their lifestyle, how we can improve their food habits, how we can improve the way they're living. So this is something that we are focusing on. We have got a big program also called Grah, which has now been launched in the last few months across the state, where our people are going to each and every house, and they will be checking for their blood pressure, diabetes, all those things, and also along with that, certain preliminary screening, especially for women when it comes to breast cancer, cervical cancer, oral cancers, and mental health issues, whether having any schizophrenia or epilepsy or even other so many depressive mental issues that they have, and other sleep apnea, sleep disorders. So we've got a 14-point program that we